COVID back in our lives? Are we going to see another wave of infections? Can India face the same crisis that China is facing right now? Is my life going to be impacted again? These are probably some of the questions that you may have been hearing around you today. Maybe you have some of these questions in mind, and we're going to try and get as clear answers as possible. Now, the trigger has been an outbreak of COVID cases in China that has not been seen thus far. China has had strict restrictions for the last few years, and a relaxation of those restrictions has probably led to a huge surge in cases. There are various estimates. Some of them are that China could be seeing 10 lakh cases of COVID and 5,000 deaths every 24 hours. This is according to a London-based analytics firm called Airfinity that has been quoted by news agencies. So what are we going to do about it in India? This is what has happened today. Prime Minister Modi chaired a high-level meeting, after which one of the decisions announced was that random screening of 2% international travelers would be taking place, anyone coming into India. So far, 185 new COVID cases were detected in India today. The total number of active cases in the country are a little over 3,000. The BF.7 variant, which is considered responsible for the surge in China, has seen only 4 cases detected in India so far, as way back as in October. On the other hand, India has approved the nasal vaccine, and Serum Institute of India has sought approval for Covovax as a booster. In the state of Karnataka, they've made masks indoors mandatory. So let's listen in first to some of the reactions coming in today.
राज्यों को भी स्थानीय स्तर पर सामुदायिक निगरानी बढ़ाने के लिए और कोविड को नियंत्रित करने के लिए सलाह दी जा रही है। राज्यों को जीनोम सीक्वेंसिंग बढ़ाकर सभी पॉजिटिव केसों का जीनोम सीक्वेंसिंग करने की सलाह दी गई है, जिससे अगर देश में कोई नया वेरिएंट आता है तो समय से उनकी पहचान कर सार्वजनिक स्वास्थ्य के लिए कड़ा कदम उठाया जा सके।
चाइना की जो स्थिति है वहाँ कोविड के वहाँ पे हम उस पर नज़र बनाए हुए हैं। हमने पहले भी कहा था कि हमारी उम्मीद ये है कि पूरी मानवता कोविड महामारी के पूर्ण रूप से उभरकर सक्षम रूप से ऊपर कर निकले, और हमने हमेशा हमारी तरफ से फार्मेसी ऑफ द वर्ल्ड के रूप में हमने मदद की है दूसरे देशों को। और चाइना में जो हो रहा है, मैंने जैसे कहा, हम करीब से नज़र बनाए रखे हुए हैं।
चाइना में इस टाइम कोरोना के केसेस बहुत ज़्यादा बढ़ रहे हैं, जिसको लेके भारत में काफ़ी ज़्यादा कंसर्न है। चाइना में भी बढ़ रहे हैं, और उसके अलावा कुछ और देश हैं जिसमें सुनने में आ रहा है कि कोरोना के केसेस बहुत ज़्यादा बढ़ रहे हैं। चाइना में जो वेरिएंट है वो है BF.7। सबसे पहले तो मैं बताना चाहता हूँ कि दिल्ली में BF.7 का एक भी केस नहीं मिला है। सो अभी फ़िलहाल घबराने की ज़रूरत नहीं है। ना केवल टेस्टिंग में मिला है, टेस्टिंग तो हम कर ही रहे हैं, जो भी कोरोना के केसेस आ रहे हैं उनकी जीनोम टेस्टिंग हो रही है। दिल्ली में अभी जो भी थोड़े बहुत केसेस आ रहे हैं वो XBB वेरिएंट के हैं, या तो XBB वेरिएंट है या उसके सब लीनिएज है।
We discussed about corona, and we are monitoring all this. We set up a committee also to take care that what is going on and what is the how to solve it, ki kore ekta solve kora jay.
All right, so all states are stepping up vigil. Things that we had sort of abandoned because of the low cases in the last few months, like genome sequencing, all of that is up again. Meanwhile, the Indian Medical Association has put out quite a grim advisory. They've said that face masks must be maintained and used in public. Social distancing is something we should go back to. Regular hand washing, of course. Avoid public gatherings. Avoid international travel. And consult doctors if any symptoms are detected. They've also recommended that COVID vaccinations and follow-up booster vaccinations are taken if required. Now, I want to just get an idea of this first, and I have with me of the Indian Medical Association, the National President, Dr. Sahajanand Prasad Singh. Dr. Singh, thank you for speaking with us today on the show. And I just want to understand the IMA circular because it sounds, I would say, more grim than what the government is saying right now. Why do you feel, sir, that there is a need to avoid international travel, avoid crowded places? Right now, we have very few cases in the country.
So thank you very much, madam. In view of the sudden surge of COVID cases in different places, Indian Medical Association becoming alert and appears the public to follow COVID appropriate behavior with the immediate effect. The government decisions very much appreciable. Our IMA issue advisory on impending COVID outbreak. Number one, face masks are to be used in all the public places. Social distancing to be maintained. Regular hand washing should be done. Public gathering like marriage, political or social marriage is to be avoided. Avoid international travel.
सिंह, यही तो मेरा सवाल है कि मैरिज पब्लिक गैदरिंग क्यों अवॉइड हम करें इस वक्त जब हमारे यहाँ 185 केस आज हुए हैं पूरे देश में।
अभी तक
क्योंकि हमें पैनिक तो नहीं फैलाना है ना।
नहीं, हम लोगों को पैनिक ही नहीं होना है, लेकिन 145 केसेस पॉजिटिव हुए हैं इन 24 आवर्स में। BF 0.74 केसेस भी मिले हैं। विदेश से लोग आ रहे हैं, जा रहे हैं, एयरपोर्ट पर उन लोगों का टेस्ट होना बहुत जरूरी है। रैंडम टेस्टिंग इज वेरी मच एसेंशियल। In Bihar, just today, I know that both Chinese and Tibetan people were all reached today here. Airport पर हमने देखा है, no one is wearing this mask. हमारे यहाँ
एक डॉक्टर सिंह ये बताइए कि जो आज रूल बताया गया है कि they will randomly test 2% people among the international travelers. They will randomly pick up 2% of those who are entering India in various airports and test them for RT-PCR and then send them away. And if they're positive, then they will be contacted. Do you think that this is enough right now?
This is not enough. This is not enough because we should be alert. हम लोग को चाहिए जहां तक मैक्सिमम जो भी विदेश से आ रहे हैं उनको कम से कम जो nasal RT-PCR is not possible, then other test is very much essential. Only 2 minutes essential. We should seek positive or not positive. So 2% is not as, so that should be increased. That should be at least 50% or 30% or 40%. Those are coming from the village abroad.
No, but then in that case, you will have huge, you will have huge lines at the airport.
नहीं, पैनिक की होने की जरूरत नहीं है, लेकिन हम लोग को अलर्ट रहना इसलिए जरूरी है कि प्रिवेंशन इज बेटर देन क्योर। प्रिवेंशन के लिए हम लोग स्टेशन में, बस अड्डे में, रेलवे स्टेशन में, एयरपोर्ट पर हम लोग अलर्ट रहना है। खास करके विदेशी जो यात्री आते हैं उसको हम लोग को देखना बहुत जरूरी है। आज 25 तारीख होने आने जा रहा है।
एक आखिरी सवाल आपसे डॉक्टर सिंह, डू यू बिलीव that we are going to see a third wave in India? Do you see the possibility of that? Not a third wave, I would say a fresh wave.
We have a possibility here, but हमारे यहाँ देखा गया है कि resistance of the Indian people are very high. Herd immunity has been already developed here, so virulence is not much more because of herd immunity. हम लोग यहाँ जो कोविड वैक्सीन दिया गया है, इंडिया का सबसे अच्छा वैक्सीन हम लोग को दिया गया है। इसके चलते देखा जा रहा है कि हमारे यहाँ यदि पॉजिटिव केसेज होते भी हैं उनको कोई सिम्टम्स ज्यादा डेवलप नहीं करता है। जो 4 केसेज अभी आए भी हैं जो पॉजिटिव हुए हैं उसमें भी देखा गया कि पेशेंट इज नॉट सीरियस, पेशेंट हैज नॉट बीन एडमिटेड इन हॉस्पिटल। तो पॉसिबिलिटी है स्प्रेड होने का, तो हाई पॉसिबिलिटी। इंटरनेशनल विदेश से लोग आ रहे हैं, जा रहे हैं, तो स्प्रेड तो होगा ही, लेकिन हर्ड इम्यूनिटी डेवलप किया है इंडिया के लोगों में। इससे बहुत घबराने की जरूरत नहीं है, पैनिक होने की जरूरत नहीं है, लेकिन प्रिवेंशन के लिए हम लोग अलर्ट रहना है, मास्क पहनना है, डिस्टेंस मेंटेन करना है, और जरूरत नहीं होती इंटरनेशनल ट्रैवल को अवॉइड करना है।
ठीक है, बहुत बहुत शुक्रिया डॉक्टर सिंह हमसे बात करने के लिए. That was the Indian Medical Association president, and according to him, important takeaway from that short interview was that this random testing of 2% international travelers coming into India is not enough. As per him, it should be a higher percentage of people, at least 30 to 40% of international travelers coming in should be tested. Now, where has all of this started from? This has all started from an outbreak of cases in China. And to see the full story, you will have to rewind a bit to November. In November, protests broke out in some parts of China, in Shanghai, Beijing, and several other cities against very strict lockdowns and restrictions that have been on in that country for at least 2 years. People were fed up. As a result, the government there did ease up restrictions, but that has seen a huge spread of COVID cases. Take a look at what the situation is in China.
What is causing China's massive COVID surge? The sudden explosion of infection in China has become a cause for global unease. And this is spurring concern that a dangerous new variant of the virus could emerge for the first time in more than a year. Even as the situation is turning from bad to worse, Beijing is only admitting to a handful of COVID deaths. This is even as reports are indicating that the death toll is on the rise, with long queues for medical facilities and crematoriums running 24/7. Some reports indicate that currently a whopping 40% of Beijing residents are infected, with some even claiming that they have waited for days to cremate their loved ones as crematoriums are overflowing. What is causing the current wave in China? The situation in China is unique because of its policies throughout the pandemic. While almost every other part of the world has battled infections and embraced vaccinations with potent mRNA shots, China mostly sidestepped both. The result is a population with low levels of immunity, facing a wave of disease caused by the most contagious strain of the virus yet to circulate. In late 2019, China downplayed the seriousness of the virus. It is doing the same again now, as it is not revealing the true scale of the spread right now. The massive outbreak right now is caused by the BF7 sublineage of the Omicron variant. And with the zero COVID policy backfiring, China is witnessing an unprecedented spike in cases. The abrupt end in restrictions raised concerns over widespread infections among a vulnerable and under-vaccinated population. The zero COVID policy is being blamed for keeping the population vulnerable to the virus. Since most of the population was never infected, it led to low natural immunity. And with it not allowing foreign vaccines, the combination of these scenarios has now led to a COVID explosion in the country. Is there a cause for global concern? Experts contemplate that there are two possibilities. Some experts say that the outbreak might spawn new mutations of the virus. With low natural immunity and less effective vaccines, chances are that a variant may emerge with greater infectivity. However, some others believe that Omicron and its hundreds of subvariants may sweep directly through. Vaccination and infections will boost immunity until eventually antibodies in the population will help control serious disease.
All right, I'm going across now to Inar Tangin, Senior Fellow, who's joining us now. He's also the Chairman of Asia Narratives and is speaking with us from Beijing. Dr. Samiran Panda, a distinguished scientist and ex-ADG ICMR with us. Dr. Subhash Salunke, Senior Advisor at PHFI, National Member of the COVID-19 Task Force, is on the show, as is Dr. N.K. Mehra, former Dean of AIIMS. Welcome to all of you, and thank you so much for speaking with us today. Let me come to you first, Dr. Panda, on your take of where we stand in India. Do you think that we are erring on the side of caution? Are we being overtly careful? Because the numbers as of now that are being reported are quite low. In most people's mind, COVID is an old story that they've put behind them. Do we need to refocus on this right now?
Well, that's a very good question. And my first response is vigil is an important element in public health response. But of course, we need not to panic in terms of public health, responses, because panic does not help in clear thinking. Secondly, what we should do, we should take care of the information that is spreading all around, and we need to facilitate fact check, because learning from the past tells us very clearly that many information would spread around which are fake or which do not have any scientific basis. For example, a new variant might be easily transmitting or transmitting very fast, but that does not necessarily mean that it would also turn out to be fatal, because any viral mutant, to be able to spread fast, cannot afford to kill its host. So my first response is that, yes, as a public health measure, we should remain vigilant. And there is INSACOG platform which would tell us what are the new variants happening. The changes in a proliferating virus, be it RNA virus, here we are discussing or talking about an RNA virus, the mutations happening is expected. However, all the mutants do not turn out to be variant of concern.
Right.
And preventing the spread of a mutant or the virus requires usage of mask. But the vaccination that we have had in India with wide level of population coverage, with 2 doses, and
but you know, the vaccine, I want to talk a bit about the vaccine, and I'm treating this opportunity to put out a lot of FAQs that people have. People have been calling me and asking questions. I'm seeing people saying a lot of things on social media. So everyone has their fair share of questions. I'm going to keep the questions simple. I'm going to request all of our esteemed panelists to try and keep the answers as simple and as in layman terms as possible so that everyone can understand what's going on. So let me come to Dr. N.K. Mehra with a question. Is the vaccine going to still protect us, considering that most people have finished their second shot almost 8 months to a year ago, at least more than 6 months ago? The coverage of the booster dose or the third shot has been relatively lower. There's some estimates that, IMA was just saying it's about 28%. So are we covered right now in terms of immunity as a population?
No, I would say, we saw a number of infections growing from January to March due to Omicron in India. And at that point of time, a lot of people were going in queuing for the booster dose. After that, suddenly the numbers have gone down. It's a human nature. People feel that the virus has gone. And today, as we see that less than 1/4 of the population has not got the booster dose. I think that is a flaw in our system. We need to really jack it up. We might have to increase our vaccination centers. We must make sure that the number of people who take this booster dose increases exponentially.
Yeah. So is the booster dose the way
for those who might have got the Omicron infection as well?
Yes, because the Omicron infection is sort of like what China is facing today.
Yeah.
Right. Okay. Dr. Salunke.
Omicron infection, what China is going through, the China problem is very different from India. China has followed the policy of zero COVID. I'm coming to that.
Dr. Mehra, allow me to come to the question of whether India will face what China has. Like I said, I'm keeping it very simple. I'm keeping it down to what people want to know and what they will understand simply. So, Dr. Salunke, my next question to you is, are we going to see a fresh wave? Is it inevitable that we see a fresh wave?
Definitely not. Definitely not. I wish to indicate...
We're definitely not going to see. We're definitely not going to see a fresh wave.
Yes. But there are conditions to that. And the condition number one, the present variant that is circulating in China, if it remains like that and doesn't mutate further, we as India need not have to panic at all. because of two reasons. One, we all, 99% Indians are either got naturally infected and got immunity, or got the, kind of support and immunity through the vaccination. So if the present variant is in circulation, we need not get unnecessarily panicky. And what we could have done in last 1 month, we are trying to do it in last 2-3 days. The entire government of India, all state governments, media, everybody has woken up in just last 3-4 days. We could have started the interventions in the November itself, when we knew that in China the things are going bad to worse. Now suddenly in 3-4 days, everybody has started, and it will have a very negative impact as far as economy is concerned. So let us first and foremost understand the science, understand the epidemiology, understand where India is protected, where India is vulnerable, and what needs to be done. The present guidelines issued by Government of India, as far as international travelers are concerned, should have done it at least 3 or 4 weeks earlier. But doesn't matter. Better late than never. That is one. Number two, use of mask is something which we should absolutely universally start insisting on, that in the closed door meetings or where there is a gathering in the closed door. These
No,
two,
but Dr. Salunki, can you explain to me why? Can you
Why?
explain to me why?
Yeah.
Let me contextualize the question. Today, someone watching should say, why should I go back to the times of masking? Because there are very few cases in my country. This is a subvariant of Omicron going on in China. We already had 4 cases of this particular subvariant in India, BF.7 in October. It's not spread so far. Why should I go back to the period of masking if there is no real threat?
Yeah, 2 reasons. That the real threat is not there, cannot be stated so frankly. So the potential of the threat is there. That is one reason we should use mask. Number 2, we are also aware other viral infections are circulating. We are in winter season. We are going in the season where festivities are going to be there. So all 3-4 factors, particularly those who are immunocompromised, senior citizens, comorbid, children with COPD, all these, if they use mask, it's advantageous. Using mask is not disadvantaged at all. I insist that use of mask as of now, even if there is not going to be mutation that may happen, nobody can say that it won't happen, but use of mask is one of the best weapon in our hand, along with the rest of the epidemiological interventions. And basically, basically, we Indians can be definitely at this stage feel that we are better protected than China. We have managed this
for
pandemic
the simple reason that they have been under lockdown for about a couple of years.
Exactly.
And now it's opened up. So they're experiencing what we experienced a year ago.
But because
Omicron
of that,
wave, which happened for us in Jan-Feb 2022, is happening for China in November-December 2022.
Absolutely
Mr.
right.
Mr. Tangent, let's get a sort of view from the ground of what really is going on right now and what the concerns seem to be. The World Health Organization said this yesterday, is that there is no clarity on the full extent of infections. There are varying reports, contradictory reports. Can you give us a clear picture?
No, I can't. I'm not a statistician, and I only have the reports that I'm receiving. I do know that a large percentage of the people in Beijing, where I'm living, do in fact have COVID-19, this new variant. But keep in mind, timing does make a difference. As both doctors can tell you, the variant has been becoming less deadly as time goes on. So if you had taken no precautions at the beginning, like the United States, you'd have over 1 million deaths. In fact, from January through this period in the United States, they've had 16,000 deaths a month. Obviously, China only had 6,000 during that whole period. What happens from now on, we don't know. We're going to have to get the statistics as they come out. But I can tell you that I've had it. I went from knowing very few people who had not been outside of China. I didn't know anybody really who had it inside China. Within the last 3 weeks, I can tell you that I don't know anybody who hasn't had it during this period, but it's very mild. I have a lot of friends who have elderly parents. They are not the 95-year-old grandmothers, 97-year-old grandfathers. They've had it, and they've been able to weather through it. There have been 2 reported deaths. To me, personally, friends of friends situations, but it's not clear. They're all over, well advanced into their 80s, and there might have been comorbidities and things like this. So the reality on the ground is China had luxury.
So to the extent that you will be able to tell us, because obviously, Mr. Tangent, you're in Beijing, but you've not gone out and seen what is happening across the city or other parts of the country. So there's a report today, which I quoted in the beginning of this show, which says that there are 5,000 deaths every 24 hours, and there are 1 million infections on right now. How would you know?
That's nonsense.
How would you know either way?
I live. Well, actually, I do. I live near one of the main hospitals, and I deliberately drove past it. This is not the only show that I've done on COVID. I also went to medical clinics which were around me just to establish what was happening. There were lines of people who were lining up for medicine, but the hospitals themselves were actually relatively empty. And in fact, at the main hospital, there were very few people. There are no lines at crematoriums. This is all false information that's being spread by people who want to sensationalize what's going on in China. What the Chinese government has done is they have opened up at a time when the Omicron is a lot less deadly. And so far, it seems to be working.
Okay, now what about reports that pharmacies are running out of medication? Are you seeing that around you?
No, I mean, in terms of certain medications, people have been stockpiling. They make it runs on different areas, but it's mostly in pockets. You do see places like Singapore where Chinese netizens who are there are buying up everything they can in the supermarkets and sending it back to China. But this has more to do with kind of panic buying. What they're getting is just aspirin, acetaminophen, things that reduce fever. They're not buying, the hardcore medicines that are necessary for very advanced stage treatments.
Okay. I want to understand, and Dr. N.K. Mehra, I'll come to you on this. What is also coming into conversation right now is India's COVID policy and China's COVID policy. And China's COVID policy is actually different from the rest of the world because they went in for a zero COVID policy. Today, China would argue that we have avoided a lot of deaths. But can you do that? Because the flip side of that is you have a large population that has not been exposed to the virus at all in any of its iterations.
Exactly. That's the point. I think China maintained the zero COVID policy right from day one. Probably it was helpful to them in the beginning of the pandemic, but as they have continued with it, you are very right, a large population of theirs has not been exposed to the virus. So the natural immunity, which is known to be stronger than the vaccination immunity, has been far less in China than in other parts of the world. Certainly it has been much better in India. Second factor for the numbers that are growing in China is because of the fact that the vaccines that they have used have not been that efficacious as the other vaccines. I mean, I would say the lesser efficacious than others. So therefore, you do see the breakthrough in infections now. And suddenly this zero COVID policy was then broken down in November there. And again, the virus was, available to be attacking a large susceptible group. And therefore, you suddenly see the numbers growing. You yourself said that there are reports indicating there are about 1 million infections a day in China with about more than 5,000 deaths, although the official report in China indicates that there are only about 3,000 infections a day and no deaths. So we don't know the exact situation over there, but immunologically speaking, yes, the population has become vulnerable to this BF.7 BF.7 has been in India since July. We have seen it, and you are very right that the Indians will say that we have also seen this strain, nothing has happened to us so far. So there are definitely differences in the two population groups. We are really talking of, on one side, a population which has been exposed to the virus, a large population has been exposed to the virus, and the vaccinations, we have already given more than 225 million vaccine doses here. So our vaccination record is very high. Most people in India have what we call hybrid immunity. And this has led to the herd immunity in India in much better scale than in China.
So I want to understand, Dr. Salunke, if this is a subvariant of Omicron that we're seeing in China, which, like we saw in India, spreads faster but has typically less fatalities and also dissipates faster as a result. Will we see China then epidemiologically recede from this fairly quickly in the next couple of months?
Yes, definitely. But it will depend upon the way things are going to be managed in China. Otherwise, what is happening, the fatality we're bound to be there. Even if China doesn't report a population which is totally vulnerable, or what we call as the population which never got infected, the severity is bound to be more. And so the fatalities will be definitely there. However, the spread of the disease, because the infectivity is so high that the spread will take place within the geographical area, and then definitely either the people recover or people die. And because of the fact that there will be more and more people recovering, the infections are going to spread. And naturally, with this situation, in next month or two, I expect the graph in China also will come down fairly quickly within a month or two.
Mr. Tangent, the real concern that the world has, of course, it's a humanitarian crisis if people get sick in large numbers and if there are fatalities. The real concern is the black hole of information. It's something that the World Health Organization has also spoken about. How do we know the real number or an accurate number based on data of how many infections, whether there are any mutations? Because that's the other question mark. When there are infections in a large population, there could be mutations. Will they spread? Do you think there's time for more transparency? There's a need for more transparency on these details coming in from China?
Quite frankly, I think they're struggling to make sure that they have accurate information before they publish it. But, your concern is a little bit hypocritical. You're not concerned about the fact that the U.S. or Europe does not record infections. They only record deaths. And quite frankly, Europe is about 1,000 people a week more, per day more in terms of deaths themselves. There's 1,000 a day in Japan. There's nowhere near that number so far in China. So we'll have to see. But this idea that somehow China is doing a bad job is nonsense. The fact is that almost half of the world's vaccines were from China, and they've been administered in Brazil, UAE, throughout the Middle East, Africa. And there's no indication that those countries are suffering any more than the countries that have the advanced
Mr. Tangent,
vaccine.
I just have your word for it. You're saying that the numbers in China are nowhere as close to that. Are you privy to central government information?
No, I'm not.
On what basis are you
I'm
making
not,
these
neither are you.
claims?
Well, I'm not making a claim. As I said to you, I don't know. I'm saying that in the past. The fact is the U.S., most countries have stopped reporting how many infections they have, period. So they are reporting deaths. And I think China has to do the same. And the question is when. I'm just saying, pointing out to you that you seem very upset and are extrapolating information which you admit you don't know. Based on what? I don't know.
Nobody knows.
You're saying,
the point is nobody knows
unless
there's a statement. Nobody knows. It's a dark area of information. That's something the World Health Organization has said. Nobody knows for sure. We have some visuals someone uploads on social media. We don't know when it's from.
Yes, and
we don't know if it's real or not.
As the time that you were reporting that Xi Jinping was under house arrest. There's a lot of disinformation on the internet. I don't think that it's necessarily reliable.
All right. The question is about reliability and information about a new mutation if it's going to come. How do we identify the next VOC? Dr. Panda, let me come to you on that. At the end of the day, globally, that's the big concern. Are we going to see a new variant of concern because of the high number of infections in China? And is that a possibility?
Three things. One, the laboratory tests, which could indicate a potential for a variant to be a variant of concern. Secondly, the epidemiological phenomena of faster spread and clustering of infections happening very rapidly. And thirdly, the clinical features. Suddenly, if we see that people are falling sick with severe symptoms, getting admitted in the hospitals and deaths happening. So all these three things need to be studied. So any mutant getting identified should not be considered as variant of concern. The appropriate term would be variant under investigation or variant of interest. So I would say that keeping a vigil on the emerging variants would be the first public health response. And in India, we have a platform like INSACOG, which does that. Secondly, there will be a whole lot of misinformation, but which needs to be corrected and checked for the factfulness in it. And thirdly, we need to have prevention measures such as usage of masks, which is just not against COVID, but other, respiratory tract infection causing viruses or bacteria. And the vaccination, of course, helps the population to attain a level of immunity that helps people not to go into the severe stage of the disease, even if they get infected. Because these vaccines are disease-modifying vaccines, not infection-preventing vaccines. So a dual public health response should be promotion of usage of masks and also ensuring that the population level coverage of vaccination attains at least 80%.
Yeah, absolutely. So we have, at least with one dose covered 100%, there is immunity because of high number of infections. I think the big, perhaps, question mark that we will have to close is whether we are testing enough or we have accuracy in terms of tests. We now have home tests, so they might not be registered in those daily numbers that we're seeing, but we can keep our fingers crossed and hope that we can at least protect our shores right now. Thank you so much to all of you for joining us on The Late Story this evening. We'll take a very short break.